back in April is kind of when I first got a heads up from our department that there would be a shortage of some generic drugs. Of course, in the genitourinary space, there was a shortage of a more novel agent for prostate cancer called Pluvicto or lutetium PSMA 617. This one has since been rectified, fortunately, and that was more for a quality issue in production of the compound. So I think mainly we should focus on the problem with supplying some of the generic drugs, the ones that have been, around for decades. Mainly in the genitourinary space, I would highlight cisplatin and carboplatin. These are essential ingredients for a lot of cancers, not just genital urinary cancers, but breast cancer, head and neck cancer, ovarian cancer. So, and one of the genital urinary cancers that we've really haven't had any advancements in many decades is testicular cancer, or what we call germ cell cancers. And that's because back in the 60s, 70s, we really tried platinum agents, whether it's cisplatin and carboplatin, and found that this is one of the most active agents for this type of cancer. So we've been able to cure widely metastatic testicular cancers with a high degree of confidence, about 90% widely advanced germ cell cancer. So, and this is why it's such a issue today, because if we're looking to cure these young men with testicular cancer, we really can't substitute with anything else. And it just so happens, even though cisplatin and carboplatin are in the same family, both of them are actually having a problem with shortages. I would say the shortage probably impacts some practices that are in the community setting, private practices, because in big institutions like where I'm at Rush University, we're part of a larger high volume group purchasing organization. So we actually have a lot of distributors and group purchasing partnerships where we get first priority when a problem like this comes about. But some of these issues have been recently addressed. I think the initial problem was a single site in India had some quality issues, and it turns out they were supplying, I think, like 80% of the world's supply of platinum. So you can see that would be a big problem if that company wasn't able to distribute and supply for millions of patients that need it. So, but it started there, but I think it doesn't end there. There's been issues with many sites. There's not as many industry type sites that actually produce these generic drugs, because the bottom line is they really don't have much financial incentive to keep those drugs on the shelf. Whereas the drugs that are still being produced as non-generics, right? They have high price tags on it. So the priority will go to the ones that make the companies more profitable, and that's understandable. But I think the Biden administration has now stepped in and recognized this as a national emergency, because patients, whether they're curative or not, they need their treatment. And there's evidence that shows that every month that goes by without getting your cancer treatment, survival decreases by up to 10%. So it's really important to address this as an emergency. So we've been outsourcing cisplatin, I think, and carboplatin from China now. The FDA has been working with these companies and accepting these products from other countries, such as China and Canada. And at Rush University, we have had some trickle in of some of these from other countries as well. I think it's a work in progress, and this is not really something new. I think, speaking with our head pharmacist, this has been going around for over a decade, maybe longer. But it gets cyclic, right? And they come in waves, and just in the past year, it's really become another major issue. I mean, we're talking about just a handful of drugs, but there's hundreds of drugs that are in shortage right now, and primarily these are generics. But when we're talking about cancer patients, I think it reaches headlines more so because this is such a dire illness that may impact a person's chance of cure and maybe their longevity. But I think there's some practices that organizations like ASCO has recommended in conserving the type of treatments. So just for instance, cisplatin and carboplatin. These are, in bladder cancer is one thing that I specialize in. We only use cisplatin for the most part in the curative setting. In the metastatic setting, we could substitute with carboplatin, and the FDA just approved another novel combination called enfortumab vedotin, or Padcev, in combination with Keytruda or pembrolizumab. So this one is actually a good alternative for patients that usually would get chemotherapy up front. It has comparable or maybe even superior response rates in this setting. So I think at least in bladder cancer, we do have some good alternatives. But I would say for some of the older fashion cancers like testicular cancer, there are no alternatives. It has to be a platinum. I would say the most susceptible ones are the ones that don't have novel therapeutics, right? The ones that still use the older drugs, the rare cancer types, right? So testicular cancer, I mentioned a lot, but penile cancer also uses a lot of platinum. This is a rare cancer, but there really is no alternative other than the older chemotherapy drugs. I think it's time to be conservative with our intent to cure a patient versus palliative patient. So when we're talking about patients that have stage 4 or metastatic cancer, we don't think we can cure those patients, but we can still treat them with comparable efficacy as far as duration of progression-free time. So when we're talking about carboplatin versus cisplatin, I think those can be interchangeable if you're not talking about the curative setting. But I think also really, write letters to your congressman and, make sure that this doesn't go by as another wave of drug shortages. I think we need to really have our next administration address this issue flat on and make sure this doesn't happen again, because it should not happen again. I think the problem is, again, financially, there's not much profit in generic drugs, but maybe there needs to be some changes within the FDA, within the government, within industry to help increase the motive to keep generic medications on the shelf.